In this video, I will be discussing ultrasound, which is a method for imaging inside the body using sound waves. I will be going through the generation of these waves and how they interact with the body to produce an image, as well as touching on some of the advantages and disadvantages of this method. Ultrasound makes use of high-frequency sound waves. These are typically between 2 MHz and 20 MHz. A transducer, which is placed in contact with the patient's skin, generates the sound wave, able to pass through the body by converting electrical energy to mechanical energy. The transducer consists of a piezoelectric crystal, typically lead zirconate titanate. A piezoelectric crystal has a property that when an electric current is passed through it, it becomes mechanically stressed and deforms. This causes the crystal to vibrate back and forth, which generates the wave. A piezoelectric crystal is also capable of doing the reverse of this, so a mechanical wave can induce an electric current across the crystal. This is how the returning waves are detected and turned into a signal which can produce an image for analysis. The ultrasound wave passes through different tissues in different ways, which is what allows an image to be produced. How the ultrasound wave travels through different tissue is affected by a number of acoustical properties. One important property is the acoustic impedance, which is the resistance to the ultrasound energy. It can be described by the following equation: Z equals rho C, where rho is the density of the tissue and C is the speed of sound in that tissue. When the ultrasound encounters a change in acoustic impedance, a few different effects can occur. These include specular reflection, which is where most of the sound is reflected. This occurs at a material with a very large acoustic impedance, such as bone. On an image, these show up as bright spots. There is also scattering, where the ultrasound wave hits a surface which is smaller than the wavelength of the incident wave. The objects that cause this effect are called diffuse reflectors, and could be, for example, small objects such as red blood cells, or organs which have uneven surfaces. When the ultrasound hits this surface, it causes a wave to scatter in multiple directions. The scattered waves have smaller amplitudes and interfere with each other. This causes a greeny grey appearance, which is called a speckle. An effect, called attenuation, also occurs as the ultrasound wave passes through the body. This is where the wave reduces in amplitude and intensity. High-frequency waves are attenuated more over a shorter distance. Therefore, to generate images deeper in the body, a lower frequency wave is needed to reduce the effects of attenuation. This does, however, cause a reduction in the resolution image. There is also another type of ultrasound, which makes use of the Doppler effect to provide additional information about velocity and direction. This is especially useful for monitoring blood flow. The Doppler effect causes sound waves moving towards a receiver to be compressed, so they have a higher frequency, and waves moving away will have a lower frequency. The speed of the blood flow can be determined using the Doppler equation, which is Fd is equal to 2 times by Ft times by V times by cos theta, and all divided by C, where Fd is the Doppler shift frequency, Ft is the transmitted Doppler frequency, V is the speed of blood flow, theta is the angle between the blood flow and beam angle, and C is the speed of sound in the tissue. The Doppler shift frequency and velocity are proportional, implying greater velocities cause signals to be Doppler shifted more, and lower velocities cause less Doppler shifting. It is also important to note the dependence on the angle between the beam and blood flow. The cos theta term means that at 90 degrees there will be no Doppler shift, but lower angles will produce larger Doppler shifted frequencies. In practice, it is best to use an angle between 30 and 60 degrees. There are many medical advantages to using ultrasound for imaging. The main benefit is that it uses non-ionising sound waves. and therefore has not been linked to increased risk of cancer. This is especially important for imaging fetal development. It is generally also much more accessible, as it is much less expensive than other imaging techniques and can be easily portable. However, the main disadvantage is that it cannot be used to evaluate structures with high acoustical impedance, such as bone or air, or structures that are encased in bone. In these cases, more advanced imaging techniques such as MRI would be better suited. You can explore this topic more in the videos on MRI imaging.